This presentation will discuss the public health priority gun control, specifically within Australia, and examine some comparative data from the United States to provide further perspective. Additionally, the Red Lotus health promotion model will be utilised to examine the dynamic and complex relationship different individual and environmental determinants have with Australian gun control. Gun control refers to set laws and policies designed to regulate the manufacturing, trading, possessing, and using of guns or firearms. Gun violence produces significant distress, injury, and death among individuals. Conversely, public health is concerned with preventing harm and improving health among individuals. Whether a perpetrator or a victim of gun violence, the research indicates men are among those most at risk. Findings indicate males account for 9 out of 10 firearm-related deaths. Gun violence is not possible without access to firearms. Therefore, public health recognizes firearms are a significant risk factor to health and considers gun control as a crucial public health priority. As well as understanding the important risk factors, public health also seeks to understand important protective factors. By understanding these factors, public health can direct efforts toward an upstream preventative community-based approach. The Red Lotus model is a holistic, ecological, and salutogenic framework for health, which recognizes an individual's health and well-being is determined by a multitude of interrelationships between the individual and certain environmental determinants. Environmental determinants refer to natural, built, social, economic, and political factors. Interrelationships between the environmental determinants and an individual ultimately determine the health of that individual and of the wider community. This ecological and salutogenic framework focuses on understanding these interrelationships and identifying important risk and protective factors for health so that efforts can be directed toward creating greater health in individuals and communities. In specific relation to gun control within Australia, a comprehensive review of the literature found no direct links between Australian gun control and the natural or built environmental determinants. However, the literature does make pervasive links between Australian gun control and the social, economic, and political environmental determinants and offers support for the effects these determinants have on individuals. The current population of Australia is approximately 25,095,347, and within this population, data suggests only 6.2% of Australian households own firearms. Comparatively, the United States currently has a population of approximately 328,732,872, and 44% of United States households own at least one firearm. This is an important comparison to examine, as the research strongly suggests firearms are a significant risk factor to firearm-related violence, and more firearm availability often results in more firearm-related death. Additionally, research has examined rates of firearm homicide, suicide, and unintentional death across 23 high-income countries, including Australia and the United States. The findings for total death rates per 100,000 people in Australia were 1.0, compared with the United States, which was 10.2. The rate of homicide was 25 times higher in the United States, and overall the United States accounted for 80% of firearm-related deaths across all 23 countries. Conversely, Australia had one of the lowest rates of firearm-related deaths across all 23 countries. These are important comparisons to make due to the significant differences between the Australian and the United States approach to gun control. Compared to Australia, the United States has far greater firearm availability and far more lenient gun laws. Research indicates the gun laws within a country can either have a positive or negative effect on the proportion of firearm-related violence. Studies comparing different gun laws found restricted firearm access and stricter gun laws were significantly associated with lower firearm-related violence and death. In 1996, the Port Arthur massacre occurred in Australia, which was a mass shooting in a local cafe where one 28-year-old Australian man used firearms to kill 35 people and severely wound 18. This marked the biggest mass shooting in Australian history and understandably brought significant fear to individuals and communities. Firearm-related violence violates the right individuals have to live a long and healthy life within a safe environment and free from fear. An incident such as this, where visiting a local cafe resulted in unexpected firearm injury and death, severely infringes on the social justice and health equity of individuals within communities. Social justice refers to ensuring fair and uniform opportunities throughout communities, whilst health equity refers to every individual having the right and opportunity to live a long and healthy life. Importantly, the social justice and health equity within a country is very dependent on certain social and political determinants. Following the Port Arthur massacre, the Australian Parliament came to a unanimous agreement to promptly sanction the National Firearm Agreement, known as the NFA. The NFA enacted clear, uniform regulations across all Australian states and territories which prohibited particular semi-automatic and automatic firearms and required all firearm owners to legally register all firearms, demonstrate a legitimate reason for owning a firearm, undergo firearm safety courses, and keep firearms safely secured at all times. Media publications at this time reported data from public polls that suggested 90 to 95% of individuals supported the new gun laws. Additionally, the NFA introduced a government buyback initiative where the Australian government paid people to hand in their firearms. During this time, the Australian government purchased and destroyed approximately 700,000 firearms, which nearly halved the number of firearm-owning households. In relation to the economic environment, the buyback initiative cost $500 million, which was financed by a one-off Medicare levy increase from 1.5% to 1.7%. Australia currently has a Medicare levy of 2%, therefore the buyback initiative did not appear to account for significant economic cost. Importantly, during the 18 years prior to the Port Arthur massacre, Australia witnessed 13 mass shootings, and ever since the alteration to Australian gun control, there have been none. Gun laws and regulations are the responsibility of the government. In relation to the Red Lotus health promotion model, this demonstrates how social and political determinants can have a powerful impact on individuals and the wider community. Political regulations such as firearm restrictions and strict gun laws function as important protective factors for preventing physical harm and ill health. Additionally, political determinants largely impact the economic environment and distribution of resources within a country. In terms of gun control, research in the United States indicates the societal economic cost of firearm-related injuries over a one-year duration equated to $174 billion. There are no published figures for economic cost of firearm-related injuries in Australia. However, to give perspective, over a one-year duration, the total health expenditure within Australia was approximately $180 billion. This suggests firearm-related injuries cost the United States almost the same as Australia's entire health expenditure. Research findings between 1991 and 2001 show a significant 47% decrease in firearm-related deaths. Additional findings indicate firearm-related deaths decreased from 618 in 1991 to 326 in 2001, which suggests a reduction of almost 62%. Furthermore, findings within this research suggest a continued decrease from 327 in 2001 to 238 in 2016, which represents a reduction of approximately 27%. Additional literature has estimated the Australian buyback initiative led to an 80% decrease in firearm-related suicides and has, as such, mitigated over 200 firearm-related deaths each year. Cumulatively, this research suggests a significant increase in lives saved and strongly suggests that the Australian social environment has benefited greatly from Australia's gun control. In terms of an ecological and salutogenic framework, Australian gun control is an example of an upstream prevention approach where the political environment identified a significant risk factor and implemented specific policies designed to function as protective factors to prevent future gun violence occurring. Specifically, restricting and removing firearms shaped the Australian gun culture and has led to the creation of greater health amongst individuals and communities.